774 ABC Melbourne, ABC Victoria. That's home BTM. It's 2:15. Sitting in front of me, Kusal Goonewardena is sports physiotherapist for the Melbourne University Elite Athlete Unit. Does a few other things. Hi, Kusal. Nice to see you again.
Thank you, Richard.
We chatted about a year ago.
I think so.
What is your official position? Did I get your title right?
Yes, well, I'm the head of sports medicine at Elite Akademy Sports Medicine, and we provide, we're the official providers of sports medicine for the Melbourne University Elite Athlete cohort.
Okay, so I thought I'd get you in to have a chat about physiotherapy at an elite level, but also those of us who are just getting off the couch for the very first time and some of the things we come up against. I love this SMS. This covers a few of your topics today. I'm an obstetrician and am comfortable with life and death. Currently pregnant myself. I frequently run. Apologies to the physio and pelvic floor. I'm sure you do your exercises. Through the Melbourne General Cemetery. It's refreshing and peaceful. And also annoying. I encourage others to go. Also annoyingly, my husband misquotes down in the boondocks with boomdocks and can't be talked out of it. It's from Jane. Well done, Jane. You win. Yeah. And a lot of you liking that track. Home BTM is what you can search for as the name of the band. And Simon's gone, yeah, it's an X-ray and ultrasound on my shoulder. Right, in I go, I'll talk to you later. Because that is the sad thing about exercise. We tend to injure ourselves when we exercise, just because wear and tear on an engine. It's probably true of all elite athletes, isn't it, that they're not 100% fit?
Yes, and ultimately you treat your body like a car. So the more you run your car, say you need a service every 15,000 kilometres, and that's when you would service your body, or that's when you'd service your car, you treat your body in the same way. So if you're doing a lot more exercise, if you're doing a lot more activity, then you want to get the body serviced. And the servicing then involves either seeing a physio, your massage therapist, any kind of clinician.
Yeah, I was going to ask you that. How important is massage when we're exercising?
Very important.
Really?
It is very
just feels like naughty and slack. That's an hour I could be training.
It could be, but that's depending on how good a massage you're getting. So if it's a really good massage, when it comes to remedial, when it comes to sports massage, you're noticing what those tight areas are, and you're getting someone to work on it.
What's a good massage?
A good massage is one that doesn't hurt. So if you're wincing in pain, you've got tears in your eyes, that's not a good massage.
I can't stand getting hurt for an hour and then giving someone money.
That's not
it's real, and I'm not allowed to defend myself. They frown on that. So I can't.
No, that's not a good massage.
Really?
And on the other end of the spectrum, you get the really light massages. That's not good either. Okay. So something in between where you're noticing it, you're noticing a tight part of a muscle or area that the person's working on, and you can tolerate it.
So what's a massage supposed to do?
A massage...
What is it actually physiologically doing? I've got a sore hamstring. No, I've got a sore quad, let's say. And it's sore because I've torn the muscle fibres through... I put a great demand on the quad and it's torn the muscle fibres and there's some bleeding in there and that's creating the soreness. What does a massage do?
So there's two problems you have there. First is the quad being torn, or the problem itself. It's caused because another part of your body has not worked properly. So there's always a give.
Yes.
In your case, the quad has given. Now, what I'm talking about massage is any areas that we work continuously, you want to get that massaged or get that...
And what will the massage deliver to us physiologically?
What happens
feels nice, but what does it do?
The muscles tend to loosen off first with deep tissue pressure. Secondly, there's a constriction of blood flow. First,
by loosen off, do you mean the muscles in spasm?
Yes, the muscle spasm loosens off,
right?
And then first, with the deep tissue, there's actually a constriction of blood flow first, and then as there's a release, there's an increase in blood flow, and that flushes out any toxins.
So I'm not even sure what toxins are, but
so anything bad that you're feeling, anything bad in the muscle, so anything
toxins is just one of those words that I think is gibberish. But let's not get sidetracked into. Okay, I get this. Muscles is in spasm. It can be worked on and that will help release the spasm, and there's a build-up of blood under the surface of the skin from the tear, and that can be worked to flow. And also when the muscle's in spasm, veins are constricted, the blood flow is lesser, so you won't heal. That's why we light exercise after we've strained something. The way to stop feeling sore is to go and do the activity lighter.
Very true.
Okay. Let's put my pet hate of toxins to one side. Kusal, were you drunk when you wrote about 3-minute workouts?
No, it was one of the things that has come out. We created this exercise program because first I had people saying, Kusal, I don't have time to exercise. So we had to create...
Do you have time to die?
Well, the thing is, a lot of people don't realise the importance of exercise.
Yeah, that's true.
So we needed to come up with a program that was short enough where people weren't making excuses, so people can do the 3-minute workout, and it has to bring in the results that would be beneficial, the benefits you would get from exercise.
It's not going to happen.
So we have found that by merging these two things, one, cardiac function, so
Yep.
heart, lungs,
Yep.
pulmonary function, and the other thing that we didn't think could happen, metabolic function. So
Yep.
when we put people to the test, we did 3-minute workouts, high intensity, so people push themselves to 85% of what they can tolerate,
Yep.
and they do it for 21 days straight.
So
And
3 minutes a day,
high intensity
a very high intensity, has effect.
has effect.
No.
Yes.
Oh, Munyaka. How can that develop cardio function with 3 hours? Isn't it 3 minutes? Isn't our whole exercise regime built about holding our heart rate over a period, notionally 20 minutes, but over longer, maintaining our heart rate up? How does this work?
Actually, the research was comparing those two groups, and they found that metabolic rate, heart function, and pulmonary function, so the lungs, all improved better than moderate exercise over a longer period of time. Yeah.
Interesting.
So it's very interesting. It's the latest stuff.
I'm pushing Kusal because we've met before and we're chatting, so I feel confident in jostling him around, and also he knows what he's talking about, so he'll be able to deal with it. Before we leave massages, this is a good question from Jenny. It happens a bit. I feel nauseous after remedial massages. Could you ask your physio why that is?
Sure.
Why is that, Kusal?
The reason why people feel nauseous, it's the autonomic nervous system being triggered. When the body has a build-up of tension, sometimes there are areas in the body that hold a lot more pressure than others. So, the mid-back, the glutes, the shoulder blade muscles.
Yep.
And when they're released, the brain says, wow, something's happening here, I need to protect the system. So then the autonomic nervous system kicks in, which is, you might get sweaty palms,
Yeah.
you might get all sweaty, you feel nauseous, so that's actually normal. If it continues, you can ask the person massaging or treating you to go a bit lighter. Otherwise, you will start getting results a lot faster, because that's one of the major causes of the problem anyway.
Okay, so that's actually a good sign, and it's a normal sign, providing it doesn't continue.
Yes.
Do we just sit quietly and have fluid? Will that ease that feeling?
That does ease it. I've had situations where people have had that feeling, and you simply say, this is actually a good spot, let's continue working on it. There's two options. I can go lighter and we can get the results a lot longer. It'll take a lot longer to get the results. Or I can go in at the same pressure, and if you're feeling nauseous, that's okay. You can go up, throw up, come back. So it's as simple as...
That's not a massage, it's awful. Because I've got SMSs taunting him about the 3-minute workout along the lines of, it sounds like 6-minute abs. I do think, though, that sometimes in exercise, you might see this not so much in your... Actually, I reckon it hits elite levels, where you've built up your exercise, and you're so used to now you run or you ride, and it takes 2 hours or something, and then you go, well, do you want to go around the block for 10 minutes? No, there's no point. There's nothing to that. But you end up actually doing nothing in the day, whereas a 10-minute burst of something would have been better than nothing. Is that
exactly?
So, elite people set their workouts very high and don't think there's benefit from anything other than a very high level workout.
That's true.
You see that?
And also, when people have these excuses, we see these excuses coming up more in winter times, because, okay, it's raining outside, or I can't go out, or, it's too hard to leave the house to go and exercise. And a lot of times, as human beings, the winter months are hibernation months. So we created this 3-minute program so people can do it at home and they don't drop. So they keep up a level of fitness, they keep up a level of improvement, and they don't drop.
Okay.
I'm turning you around, I think.
No, not even slightly. It's just I'm being polite instead. Okay, 3 minutes. Jeez, I take longer to put my shoes on. That is nothing. This SMS. I'm a 55-year-old woman, more Clydesdale than Elite. Been training for 2 years at my pace and dropped 20 plus kilos in the process. I've signed up for Tough Mudder in 5 weeks. Yikes! Any tips on prep and training? That's from Chris. So that's a great question, and well done, Chris. Chris has been going at her own pace and has dropped weight and been effective. And she's done that other great thing that you can do with your activity, which is, okay, I've set a goal and I've publicly said it, I'm going to try to achieve it. But she's got 5 weeks. She needs to step up her training a little outside her comfort zone. What's the most effective way for her?
The most effective way, first, is to listen to her body. So when she's exercising, she wants to try and replicate most of the activities in Tough Mudder. Now, if that's not happening, then preparation is not optimum. So for her, ideally, she wants to, when I talk about listening to the body, it's about doing an activity and then thinking, oh wow, my knees are really hurting or aching, or my back's really hurting or aching. Get that sorted very quickly. So that's where sports physios come in. That's where the practitioners come in to solve and make sure that the whole body's working most efficiently.
Okay, so listen to your body if anything's creaking, groaning, hurting, get that seen to.
Yes.
What about the method of training? I always bang on about fartlek, about interval training as being the most bang for buck type of training you can do. Are you nodding or are you frowning at me going,
no,
that's stupid?
Interval training is very good because it pushes the person outside the comfort zone for a short period and then allows them to come back. And little by little, they can continue to train upwards. It is a very good way of training.
Statistically or evidence-based, does it deliver better results than if I just train at the same pace?
Yes, it sure does. So this was some of the research, once again, coming out of Norway, that with the interval training, the person will ultimately get better results. But then if we can push into high intensity over short bursts, you're going to get faster results. So people have been found to get better results in 3 to 5 weeks with a far bigger improvement.
Okay, so that's the answer, Chris. Do a little bit of that 4 minutes of your steady pace, 1 minute at your fast pace, break your exercise up into 5-minute blocks, gradually push that. Would you keep the, just on that example, Kusal, would you keep the 4 minutes and make it 2 minutes of fast activity, or would you go 3 minutes and 2 minutes? In other words, keep the 5-minute increments. Would you keep your rest period the same and push your sprint?
I don't really mind as long as it's structured.
Okay.
At the same time, if she can choose activities that she is going to enjoy while exercising, she will see far superior results. So, interval training, do activities that she enjoys.
Yep.
Because then she's actually preparing her body and her mind.
Don't ignore pain. Use that as a warning sign to go, I'll just get that seen to, I'm not going to push through it.
Yes, there's 3 warning signs. First is apprehension.
Yes.
Secondly, there's stiffness, tightness.
Yeah.
And the final one is pain. A lot of people ignore the first 2, apprehension, and the second one is stiffness, tightness. They think, oh, well, I'll just exercise this out.
Yeah.
Those are
Walk it off.
Yeah, exactly. Those are 3 zones that we work on, which is the green zone where people are perfect, exercising well, they're doing everything at what they feel comfortable in. Yellow zone is apprehension, stiffness, tightness, and then pain is the red zone. So unfortunately, a lot of people come to us when they're in the red zone, so they're complaining about pain.
And I guess because you're a great believer in referred pain, it's something appears in my shin, but it's come from my back kind of thing. So I guess if we're apprehensive, then we're going to carry our bodies differently and therefore might, your body's a union shop, right? One out, all out. So if you carry yourself differently, if you run differently, you're going to put some extra kink onto the knee or the elbow.
And I think that's a really good point you brought up. It's actually people lose normal movement. So when people lose normal movement, you lose the proper way of moving, the proper activity of muscles, nerves, joints, ligaments, and therefore that ultimately gives you a breakdown. And, the situation where a person might come in with a knee problem, but we're actually treating a completely different area is very much the norm. And it's and that problem-solving technique, which is one of the latest in Australia, called the Ridgway Method, is one of the techniques that we use to actually get the results.
So where you got the pain may not be the issue,
Exactly.
simply put. Lots of people just talking about high-intensity training, HIT.
Yes.
Kusal, sitting in front of me, is an elite physio at the Elite Academy, and he torments Melbourne University elite athletes and some of the best athletes who go to the Summer Olympics and Winter Olympics and World and National Championships. He torments them, just stands there with a stopwatch gun again. So let's see. Normal 30-minute exercise creates a new normal within the body, but a furious 3 minutes jumpstarts the body into improved fitness. There's this person putting forward the theory. And this one, Richard, I'm a road cyclist, same age as you, so that's 57. A while back I started to supplement my bike training with some high-intensity training. On a stationary bike, I do 60 seconds flat out with a 60 seconds rest 8 times, bracketed by 3 minutes warm-up and 3 minutes warm down. I'm now stronger and faster than all my cycling buddies as a result.
Wow, Richard, I don't know. Are you changing your mind now?
No,
I don't
Greg
know.
doesn't know anything. It's probably just your mate texting in.
Well, yeah, possibly. No, I don't think so.
Critically there, which I like better than your ridiculous 3-minute abs or whatever the hell it was, is that Greg's got a warm-up and cool-down period. So I would have thought that you can't get benefit from the 3-minute workout because you've got no blood supply to the big muscle groups. It takes you ages to really start you warm up and you just, off you go.
The importance of a warm-up is getting all the muscles you want in your activity to be working as close to 85% as possible. Funnily enough, when you're doing a 3-minute, say a high-intensity workout, although you're pushing yourself to 85%, you're gradually building it up to that point. So we have found that, warm-ups are very important. So, doing something to help get ready is important.
You're not 57. When I lift, I've got to do a warm-up set and everything hurts and creaks. And if I was to stop at pain, I'd just stop there. But the second set, when I load the weight up a bit more, is much easier and smoother because everything's gone, oh, God, really? All right. And then I'm all right.
Look, at the end of the day, lots of people are different. But when it comes to this exercise program, say for the 3 minutes, starting it off and going to what you can tolerate first and then building it up, you will find over a period of time that things get easier. Also, the warm-up isn't as important, but you will find things you can add it on.
It's very confident about this. See what you think. Pop your headphones on for a sec. Nicholas is called up.
Sure.
Nicholas, are you buying the 3-minute workout? What are you feeling?
Physiological.
Hang on, you're just coming and going a bit, mate. Just turn your head a little bit so we can get you.
Is that any better?
Yes, it is. Beautiful. Say again.
Okay, so I haven't researched physiological training for quite a few years, so what I know is most likely out of date. In fact, I'm sure it's out of date, but my understanding is that the more low-intensity training you do, the greater base you build, and the greater base you build, then the higher peak you can achieve. And the high-intensity training comes on top of the base, not instead of it. Now, is the person you've got with you saying that Olympic athletes can train 3 minutes a day and achieve their goals?
Yeah, that's a good question, Nicholas. Just taking that road cycling, aren't I better to sit watching a movie, cycling at a steady pace on the spin bike to build the endurance in my legs as opposed to just do high-intensity training?
The benefits of doing the high-intensity training are, overall, as we've seen, it improves cardiac function, lung function, and also metabolic rate. You would not dismiss one or the other. You have to do it in a combination. With elite athletes, it's so important to do both. And the other part to all this training is that it has to be sport-specific. So with our elite athletes, they have high-intensity training, low-intensity training, plus sport-specific training. For the regular person who is not doing anything at all, if they start, and I'm talking about those people who have these excuses, I don't have time for exercise, I don't have time to, get out, or I want to know how I can start. Doing this 3-minute program is one way to kickstart the program or jumpstart the program.
Kusal, thank you. We've got so many SMSs. unfortunately, because it's a 3-minute workout, many, I'll just name him, Gary and Gippsland, several others, just ask you if sex qualifies as HIT. No. I'm going to say no. I think it was the time that made you think that way. Kusal, what's coming up for you next? What's the latest you're going to torture people with?
The latest, what we're finding now is, first, looking back at where problems come from. Richard, you were talking about your quads problem. Usually, and we've been finding 75% of the time, the problem's not coming from the torn quad, and the problem originated somewhere else. So, biomechanically, looking at those areas.
My quad's sore because someone put an elbow into it. I just want to point that out.
I think that's different. Yes, that's different.
So the biomechanical, looking at injuries, that's fascinating. Because it's great to chat to you. Thank you so much for playing. I will try a month of 3-minute workouts. Look out for me to be dangerous next time.
Only 21 days. I just want you to try 21 days. Actually, if you do 5 days first, and you will start getting the results
after this, while the music's playing, I'll get you to write out my program.
No problem.
Thanks, Kusal. 774 ABC Melbourne, ABC Victoria, ABC Victoria, ABC Victoria.